Good afternoon. I am the fill-in for Jennifer Marenke, but it's been an honor to work with Jen and Mike Coachman, who are gastroenterologists. I'm obviously a surgeon, as the SAGES representative to the AGA project. We're going to talk about the early results of the National Prospective Registry. So I get 7 seconds to talk about everybody's conflicts, and I have no conflicts personally related to what we're going to talk about today, but these are our collective conflicts. So endoscopic sleeve gastroplasty is emerging as a treatment option for obesity. And if you came from the SAGES Stories talk and listened to Bruce Shermer, a very well-known bariatric surgeon, senior surgeon, he came to the epiphany that for many patients, endoscopic sleeve gastroplasty is going to be the right option for them. So he learned how to do this, which is pretty impressive, since they often say you can't teach old dogs new tricks. And I'm going to suggest to you, whether you're a young dog or an old dog, that this might be a new trick that might be worth putting in your tool bag. The questions do remain, however, like all new technologies, about the relative safety, the efficacy, and the long-term results. In addition, it's not paid for by most of the payers. So, there's a lot of work that goes into it. And we saw Bruce talk about it as an effective option for people that are self-pay, because the cost of the gastroplasty is far less than the cost of a sleeve or a bypass for people that have to pay out of pocket. So we're reporting the first 6 months of a national registry where we will be following results for many years. This is just the initial presentation, and we're thrilled to be able to share that with you. So what is this? So this is a national, prospective, multi-center registry. It's aimed at capturing the event use and down to the details of how many stitches and, exactly, what resources are utilized in these patients. It's for consecutive patients undergoing ESG for the treatment of obesity. So our baseline data for the ESG registry has 80 patients, 62 of which are female. The average age was about 48. And the baseline weight was about 105 plus or minus 22 kilograms, so a good level of weight. And the essence of the results for this, that in the first 30 days, the weight loss was about 8%. At 3 months, it was about up to 11%. And in this registry, the weight loss at 6 months was at about 13%. So total body weight. So if you think about excess weight, it's a higher percentage of the excess weight, but of the total body weight. So as you look at this operation, will need to continue further out because we don't know where this is going to plateau. So we'll be reporting 1-year data, later on as the time goes by. But this is one of the first consecutive patient trials in a multi-center randomized fashion. So when you look at this, the first thing that comes to mind as we think about short-term consequences are what are the immediate and delayed complications. So as somebody who sits and evaluates case reports and looking at complications, I've had the privilege of being in the weeds over some of these and adjudicating it, but it looks like that the immediate complication rate is about 7.5%, which isn't too bad. But only a small percentage of these are really clinically relevant. So it's even better than that. The most common reported complications, since when you're doing a case report form and you're reporting adverse events, is nausea and vomiting. So you capture everything. Abdominal pain and fever were uncommon, and although 2 people were hospitalized, 1 went to the ED, nobody was reoperated on, which is a very good result. Of the delayed complications, there were only 3 patients, and they all occurred within 30 days. The most common complication, again, was persistent nausea and vomiting. That's not unlike what you see in the gastric sleeve population. Dehydration, again, not unlike what you see. and that the leak from a delayed or indiscretion, one was treated conservatively, where a patient literally ate through their operation. So poor compliance contributed to the last one. This was all reviewed in the DSMB, and we would continue to move it forward. So in conclusion, we think this is a promising, minimally invasive procedure that will be applicable for a select group of patients, and that we will continue to perform long-term follow-up over the next several years to really track the weight loss. And I think that's an important point. If you think of the biggest and first endoscopic suturing procedure was EndoCinch, and so until you're out 3 or 4 years, and I think we're just getting to 3-year data, Bruce talked about that earlier, until we're really out 5 years, we're not gonna really know how to position it, but I think the initial results are very encouraging. Thank you very much.